everyone, and welcome to The Higher Estate. My name is Dr. Ira Price, and this is where we talk about everything related to cannabis. We bridge the gap between the medical and the lifestyle worlds. But right now, it's a little different. I haven't been around probably since September. Mainly because I was coughing, and hopefully it wasn't COVID. The truth is, I think I may have had it, but I mean, that was back in October. I don't know if it was even around, but it took me 3 months to get over a really bad cough that I have, and I don't really have it anymore. So thankfully I'm healthy, and we're coming back, and we're coming back with a vengeance now. We'll be every week on Wednesday, hopefully 3 to 4:20. If we can't do it at that time because I will be in the hospital working in the emergency departments, then we'll figure out a time on Wednesday so that everybody can watch. We have a really good show though, and the way that we're coming back, just quickly talk about our format. We're still gonna do our guests that we always have on, and we're gonna have a theme by a month. And then also we may or may not review a cannabis article using the bullshit meter that we were using previously. But it's going to be a lot of fun, and I will probably be swearing as I usually fucking do. But hopefully my mom won't be listening. And I don't have the swear jar here. It is still at the clinics. So let's get started. We do have a new co-host, everyone, and that's Janelle. What's up, Janelle?
Hey, happy to be here.
Thanks so much, and can't wait to work with you. We're going to be working together at Cannabis.wiki, and we're going to be working with Derek is in there too, somewhere in the background. He's producing the whole show, which is awesome, and we're going to be doing PR, doing a whole bunch of things, and Janelle's going to talk a little bit about that. But and then our guest today, who's an awesome human I've known for a couple of years now, his name is Gerald Major. He is the president of CFAMM, which is Canadians for Fair Access to Medical Marijuana. And we're going to have him talk about his story, how he got into the whole thing. And what's up, Gerald?
Good, man. How you doing?
Glad to that you're here, and glad to have you.
Yeah, man.
So that's basically what we're going to do today. When we start talking about the news, Janelle's going to get into the news. But first, let's go to COVID Corner, because right now we're in, as Derek says, we're in uncertain times. And we're all actually podcasting from a distance now. This is all virtual. Usually we're so used to being in a studio or in our clinics, and now we're all in our homes or wherever we happen to be. And it's the new way. And thankfully we have Derek to thank for the whole platform that's able to bring us all together. But I literally just got off the phone with we had a 2-hour meeting with our hospital. So aside from working with cannabis, as you know, I'm an emerge doc, and I work here in Hamilton at the at our trauma center and our cancer center. Excuse me. And we have updates. We used to be monthly. Now we're doing weekly meetings because we're preparing for the surge. What I can say, you know, just on a light note and on a happy note, is Ontario, or at least Hamilton, I could talk about Hamilton in particular, Hamiltonians have been listening to the social distancing, or let's call it physical distancing, because we should socially still be connecting. You know, we were expecting to see the surge already, and we're flattening that curve, I think. So we're still a week away from it, which is great. And we are seeing cases come in. We're seeing more cases than we had in the week before and the week before that, but it's still not overwhelming. Our capacity to care for the patients that do come in is still there. And right now we're still prepping, and that's really good. Unlike some cities, like if you look in states in the U.S. like New York or Seattle and all these places, you know, like there's they're getting overrun, but we're doing okay. Yesterday, Mississauga came out with the Trillium they announced that they had an outbreak. They had about 20 patients now on a ward, I think, that have it, and a whole bunch of healthcare practitioners and healthcare workers that are infected and at home sick. But still, guys, I think the key here is social distancing or physical distancing is still key right now. I just read an article that likely this is going to happen. We're going to have to do this until July, is what the government is saying. Hold on, let me see. I think that's what it says. Yes, it's till July. I think the Trudeau just came out, likely at best case. I was thinking June, but I think July is probably more realistic to see what's going on. So we just have to stay strong, stay together, stay mindful, and I think we're going to be just fine. So, well, I don't. It's going to be a tough couple months, that's for sure. I mean, people are starting to lose their shit. I'm losing my shit, and for those who have kids at home, I don't know what you're doing with them, but like, I need more activities. So, like, do me a favor, let me know. Right? All right. So, let's get into it. Let's start with our guest, Gerald. I'm really happy to have you here.
Yeah, I love talking to you, man. There's so much, every single time we meet, we catch up on everything patient and physician. I mean, I get more value a lot of times just out of the conferences and my network than I do through the actual healthcare system. So good on you for doing what you do, buddy.
Thanks. It's sometimes it's like it's fucking tough, you know, like sitting between two worlds. You know, I come from the community and I am the community, and the community looks at me like I'm too medical, and then the medical world looks at me like I'm too community. Yeah. And so it's a tough place to sit, but I appreciate that. And I'm really glad
to new place to sit, right? I mean, right. We've been given a big opportunity here with Cannabis.wiki to have a platform where, I mean, I sit on 5-6 different boards in the last 5 years in healthcare, and there's a lot of room for individual advocacy, especially when we've got a platform like this. So we're going to make good use of it.
Yeah, I'm certainly glad we have this platform. It kind of it also alleviates a lot of the stress in how are we going to disseminate our information? How are we going to get it out there? And having a platform, and you know, especially at a time like this where we are physically distancing from each other and can't go anywhere, Cannabis.wiki has stepped into and stepped up to the plate and is really providing an awesome platform. So we're really lucky. Today, I want to talk to you about a whole bunch of shit. I want to talk to you about, you know, how did you get into medical cannabis? What brought you to cannabis? We'll talk about some opioid stuff and talk about what you do all together. But, you know, first, just like, who are you? What brought you to fucking CFAMM? What brought you there?
You know, I got ankylosing spondylitis, which was also psoriatic arthritis at 14 years old, right? So I went through my university days. I actually didn't finish my university career. I'm 2 electives short and a bunch of practicums. I was going for kinesiology. I was an athlete. All that stuff got stripped away from me. Fast forward, I made it through the young adult years where suicide risk in young men with psoriatic arthritis and psoriasis, it should be a national health crisis. Made it through that. Started, I was working at AGF, which became Citibank. Then I moved 300 jobs, which is probably now hundreds of thousand jobs out to India. On behalf of Citibank. That was 9 months. I found Ayurvedic therapy. I found out that diet and exercise are helping me a lot more than anything else. And I found out that stress was basically gasoline on inflammation. So then, you know, I started having surgeries. I got taken out of work about 10, 12 years ago.
Let me ask you a question. Hold on. So first of all, where did you do kin? I did kin at York. That was where I did my undergrad.
Yeah, I did at York.
Yeah, that's awesome. I fucking love that. I love that program. I started in 96 or 97. The first year they had kin.
What year were you born?
So,
I'm 72. So we're
oh yeah, you know, you're older than I am. I'm 78. So
yeah, it got better after we left. It got a lot better, but yeah, though kinesiology at York University. I stayed at I was Bethune College. I stayed on res second, third, fourth year.
I was Founders College. I remember they just what a crazy story. Okay, I'm gonna interrupt a sec. We're gonna get back to you, but when I started, it's funny. It used to be called phys ed, and then they changed it to kinesiology the year that I got in, and I'm like, what the fuck is kin? It was
I don't know. I don't know that it was the. I'm going to call the bullshit detector right now because I'm not sure it was when you got there. Because if I'm older than you, it was kinesiology certainly when I was there.
It didn't start kin until '96.
Huh,
It was called phys ed.
I'll show you my. I'll show you my grades.
I want to see where it says kin on there because it was the year that I got in. But okay, that's fine. All right. Well, I don't think so, but we'll go back to that. Anyway, all right. Sorry to interrupt you.
Get a 1 on the bullshit detector, meaning it's complete bullshit.
I don't think it's complete bullshit. I'm telling you, I'm pretty sure it was the year that I got in because I thought I would never have taken a course called kinesiology because I wouldn't have known what the fuck it was then. I'd be like, kin what? I thought I was taking.
Let's bet you owe me a free surgery if you're capable of doing it at any point in time. I can call you up and I get in quick.
I'll try to connect you with an orthopod who can do your surgery quickly because you don't want me doing your feet.
I need to know if I land in a situation where I need you to do surgery, then it needs to be right like that.
I can't do surgery. I mean, what do you want me to cut your toes off? I do that, yo.
You'll take care of me if cancer comes a knocking.
That I can do, but hopefully that won't happen. If you need a sports medicine physician or an emerge doc or a coroner, or hopefully you don't need the coroner. I can help you with that. Hey, I'll come first to your house when you need a coroner. How about that?
Actually, you know what? You're doing enough for me on opioids, so and you're doing enough for everyone else on opioids. So you're I mean, you're wrong on this one, but I'll give it.
Okay. Well, we'll see. I want to see that. I'm gonna Google. Could somebody Google when did phys ed turn to kin at York? Let's see how that goes. Yeah, Janelle, look that up.
I will.
Okay, let's go back to psoriatic arthritis.
Yeah.
What is psoriatic arthritis? You know, so I know you said you were diagnosed at 14. That's pretty early to be diagnosed, and it's super painful, inflammatory. So talk about it. What is psoriatic arthritis for people that may not know?
Yeah, I'll breeze through it quick, and then I mean it's important for me to have healthcare professionals actually kind of validate what I'm saying, so then you can flip back and do the same for me. But I mean, within arthritis, you know, there's some say 400 different types of arthritis, which is inflammation. So this is all autoimmune for me. It's the inflammatory arthritis. So there's a little bucket in there that's very complex that's called spondyloarthritis. Short name, the acronym for it is SPA, but is certainly not a spa. I have ankylosing spondylitis and psoriatic arthritis both, which is peripheral inflammation and back inflammation. With the inflammation comes risk of heart attack, stroke, and then I log 14 different comorbidities within that are complications in that very complex form of arthritis. So you look at my hands are all tweaked. Right.
Wow.
Right. So, I mean, I've had 16 surgeries in my life. 10 of those at least are joint replacements, major surgeries. And then I've got iritis. It's actually flaring now. And I've had a lens put in already. So I'm getting the surgeries that, 60, 70, 80-year-old people are getting.
Wow. Janelle, what was that?
I was saying, wow.
Yeah, it's pretty crazy. It's an autoimmune disorder that basically your own system attacks certain parts of your body and causes significant inflammation and arthritis. It's an inflammatory arthritis, and it can infect one joint, two joints, all joints, and causes deformity of bones and severe pain. And then it also causes like external manifestations like your skin, right? You get those silver patches on your skin, and the psoriasis, and those patches, those are significant as well. I've actually seen CBD oil significantly improve psoriatic arthritis. We had an emerge doc actually that I was out for dinner with once, probably about, maybe it was last summer. And he was telling me these are guys that laughed at me for about a decade
Uh,
from what I was doing. And he's like, you know what? I was at this wellness thing and somebody threw at me this ointment and I stuck it on my knees because he suffers severe psoriatic arthritis severe psoriasis. And he put it on his knees. He said it's the first time in 20 years he's ever seen his knees.
Listen, man, so this is mine. Every patient's different, as you know, but I'm a topical guy. I've been using topicals for probably 8 years. I use whatever people give to me, quite honestly. And I'm a bit different where topicals don't really get to my joint pain all that much.
Right.
But, there's other methods and ways to get that in, but specifically around topicals for psoriasis, and certainly, 16 surgeries. I put it on all my scars all the way through. My shoulder replacement, you can't even tell.
Is this all related to psoriatic arthritis? You've had all these surgeries because of the psoriasis.
Because of the psoriatic arthritis.
Psoriatic arthritis, yeah.
Yeah.
Wow.
And so anyway, but
how did it start?
On my scars, on my feet, on my psoriasis on my feet, psoriasis gets very itchy. I'm one of the lucky ones that doesn't have it like 95% of my body, but I've got it all my toes. I've got it sometimes in the there's genital psoriasis as well. There's all different forms of that. But anyway, I saw Dr. Vendor over at 25 Charlton and got checked out 3-4 months ago. So I'm all good, but the THC specifically for me gets to the itch.
Really? So you use THC topically to help?
Both THC and CBD, both topically.
And does it help? Do you get patches? Do you have patchy arthritis, or is it more the arthritis?
I have patchy psoriasis.
Yeah, that's what I meant to say.
Yeah. None actually I keep my head pretty good. Actually, my elbows are fairly good as well.
It's usually extensor surfaces. So and you'll see it on joints and extensor surfaces, shins, things like that. Right. And so you use topicals and it helps with the,
I use cannabis topicals. I moisturize all the time. I'm like, I'm very, my daughter calls me lotion man when I go on cruises because I just empty these containers. Nothing beats, psoriasis or skin conditions like keeping it moist, right? Right now with winter, I struggle a lot through these times, but I got a sauna and steam room downstairs that I'm pretty active in. It's a condo though, so it's closed right now.
It's tough life, eh? Fuck.
You know what, man? Like we're living in this condo right now because of my disability.
Yeah.
Because I don't do stairs anymore. I don't cut grass. I don't shovel. I don't do any of that stuff. I've put my wife and family through hell. We can transition into the opioid crisis, but 6 years ago, I was on 700 milligrams of opioids a day. And I was senior vice president at Citibank making financial decisions easily at 2, 3, 4, 500 before I left there.
So I do want to go back to what brought you to CFAMM. I won't forget about that. I want to talk about Expedition Wellness as well, and we'll get to that. But if we're moving into this now, actually, Derek, can you bring up that medication, that photo of his medications? So psoriatic arthritis is so painful. It affects every part of your body, of course. Even your mental health is affected significantly. Well, look, you just mentioned that, put your family, what it did to your family, and you can't get upstairs anymore. All your activities of daily living have been affected, but you have to take multiple medications. Yeah. In order to decrease the inflammation. And I think something we have to recognize, even in the cannabis space, that's really important, and in the plant-based medicine space, and when we're talking about more than just cannabis, is that there's no one medication that's going to help every single person. And and people that are out there judging people, in the cannabis space that are saying, you're using more than cannabis or you're taking all these other drugs and blah, blah, blah. I don't think they have a fucking understanding of what you go through on a daily basis.
They don't. Yeah. Go ahead.
Tell me about these medications.
Every single person, every single patient has their own level of threshold on whatever it is, okay? The lineup of medications that's sitting there, I will not say a bad thing about anyone that's ever prescribed any of those things during the time when they prescribed them to me. My whole thing was I would rather die than live like this, right? So when we put up those list of medications, I mean, I've changed a few from that list, but I mean, I'm very aware of what happens in my body. So if something's not working, I just don't keep taking it. We had a big deprescribing initiative a few years ago and stuff like that. But a lot of these things, I can't wait for healthcare. Patients can't wait for healthcare. I'm sorry to catch up. We got to do it ourselves in a lot of ways. So the
that's an important point.
The medications there, I mean, Remicade right now is a biologic, and we're 2-3 years out of patent right now. We're still paying full price for it. We're trying to do national pharmacare, and I've got $110,000 of pharmaceutical drugs. On there as well, one that was missed for a long time from rheumatology is that how do you expect a young man like me to be going through chronic illness, chronic fatigue, opioids, and think that my testosterone is firing? I mean, come on. So I got deletestrel in there from Dr. Comer. I've got
Love Dr. Comer. Everybody's a fan of. Yeah, he's a genius, by the way.
Of course he is, right? And so this is the type of stuff, doctor, that I get to visit you. I get to visit Comer. You know how long it took me to find Comer? 7 years, man.
Yeah, me too.
I went to an endocrinologist, and I was prescribed testosterone replacement therapy. He gave me 25 milligrams every 2 weeks. And when I walked into Comer's office a year later after being on that treatment, I was in Comer's bottom 2%.
Yeah.
And I was busting my ass at the gym and going like, I can't live like this, man. I have no energy and I'm still doing this. So anyway, deletestrel's there. I mean, CPAP, the sleep apnea machine, I got misdiagnosed, never called back. So I was 7 years untreated, constantly complaining about fatigue. So the CPAP's not on that thing. I just got off prednisone probably about 2-3 months ago. I was on that for about 15-20 years. Prednisone and naproxen, and I mean, these are all things that didn't allow me to have children. But you're gonna ask some questions now. Go ahead.
So I mean, there's a couple things that you mentioned in there that were really, that caught my attention. And the first thing you said was that, medicine is behind and we can't wait for medicine to start treating us because you're going to miss the boat. I'm dealing with that right now in COVID, where I have people, we have the medical world saying this treatment doesn't have evidence, this treatment doesn't have evidence. And I'm like, I'm giving them the David Suzuki, analogy. The dude used to walk outside while it was fucking raining, put an umbrella up and say, folks, it's raining. For the people inside, it's raining. And there's still people inside saying, it's not raining. It's not like, you have the guy standing outside telling you it's raining and you can see the rain. You know what I mean? And so people just live in that world of denial. Not only that, I mean, we don't have the time to wait. And, even pandemics, we definitely don't, like we're dealing with right now. But also when it comes to you treating yourself, I think one of the most important things we can remember as practitioners, that what I've learned from you and from patients like yourself, is that we may not have all the answers. And my goal isn't to tell you what to take, but my goal is to facilitate and act as act in collaboration with my patient in order to facilitate their treatment of themselves. Yeah, right. We're empowering patients to treat themselves is far more effective than me telling you this, like, here, take this pill or don't talk to me again. That does, that we have to find a balance between standardization and individualization when it comes to medicine, right?
Yeah, Janelle's hot on that topic.
Yeah.
What do you got to say about that?
It makes a lot of sense, because when you just kind of tell somebody like, hey, this is a medication you need to take, there's your prescription, go fill it, I find that there's a lack of understanding. I have a brother-in-law who, he's on a plethora of meds, and he actually battles with himself over whether he should take them or not, because a lot of times he doesn't even understand what he's taking, right? So he doesn't know whether the medication is doing more harm than it is doing good. And then you have to have those conversations where you have to like sit down and you have to fully explain. And I think that's what is lacking a lot of the times, that people don't even understand what they're taking, the effects or anything like that. And I think it's become so mechanical. Like, here, your prescription, just go to the pharmacy.
Right.
Pharmacist will tell you take it 3 times a day, every 6 hours, whatever the case may be.
Yeah.
And there is just, like I said, that lack of letting people know, like, this is the medication. This is specifically what it might do. This is the potential side effects. If this happens, blah, 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 blah. And like, even myself, I've gotten medication before. I never had those in-depth conversations. And then sometimes you get a side effect and then you're like, what's happening? Then you start Googling and you end up down a rabbit hole and you're like, if only I had known more about this, I might have approached it a little bit differently.
Which is why it's so appreciated. The collaboration and the team approach is really what I've learned over the last decade working with cannabis. It's what cannabis has taught me dealing with patients like that. And certainly, if you just give somebody a medicine, that happens most of the time. How many patients come back to us and be like, I have no idea what I was just told, and I'm just taking this pill. They come into the emergency department most of the time with some sort of weird ass side effect because they had no idea what they were taking. So it takes advocacy groups and patient advocacy groups to actually make these things known. And I think that's the huge role of a patient advocacy group, is know your medicine and treat yourself. Now, in collaboration, I'm not saying throw away the doctor. You still need the physician who has that knowledge and experience and education treating thousands of patients. But at the same time, you're an individual. And your body should be treated as such, and not with, here's the standard, take this and da-da-da-da. So we have to find that healthy medium. And that's sort of what I think one of the roles is perhaps of CFAMM. Tell me what, let's go back. Gerald, tell me what it is that CFAMM is doing right now.
Yeah. So I think we were going to say, like, how did you get involved? So I'll just quickly touch on that. I jumped into advocacy as soon as I started getting better and started to work towards a path. I left work and I started working on my physical right away because I had neglected that for a number of years. And then I tried the next year after the next surgery, I tried to piece in the mental. And then the next year after that, I tried to throw them all together. And when I was doing the mental is when I got into advocacy. So I did a cannonball, big belly flop into the the advocacy world. And I ended up on 5 different boards pretty quick. CFAMM was the last group that I found in that group, and it was because I went through all these groups and quickly found out no one was touching cannabis 5-6 years ago when they're having the DIN conversation back then when I was about to blow my head off. And so anyway, I ended up finding CFAMM through the Best Medicine Coalition. And that's a group it's a coalition of a bunch of different patient groups that advocate for medication access, no matter what it is. And I'm like, okay, so what about cannabis on this agenda and the DIN conversation? So I found CFAMM. So CFAMM and any other grassroots patient organization, CFAMM right now, currently, we're going through a rebranding that we're pretty excited about. We've got some funds that are committed that are in the COVID mail. And so we're getting really excited to relaunch, rebrand. We started as an access group, 2014. We were having issues with access and stuff. So in the last year, we've kind of reflected. We've done a deep dive on strategy. And we've said, okay, well, we've got access. It's not perfect. We're going to still remain focused on some things, but we're really looking towards education and research and empowering patients. I mean, what we just talked about here was, a lot of things where you've got, like COVID, for example, right now. I had a really hard time adjusting to it and getting into a routine. But now that I'm here, I actually like it better. I'm a patient. I don't like to drive places. I don't like to drive in cars. I have arthritis. I want to be doing this kind of stuff. And I don't have to be in the studio right now. So it's actually kind of perfect. But also the fact that we've been so long coming to cannabis as a medicine has basically made it essential for the cannabis consumer, the cannabis patient, to be very, very empowered and very, very in tune with this medicine, because no one's ever supported them. So what we're going to be able to do now is transport some of that knowledge and empowerment from cannabis and bring it over into, patients in general. So there's some good things here, but CFAMM right now, I mean, we just put in through a petition early last week before we found out about essential services. We're still waiting for federally confirmation that it's deemed an essential service, which it's a long way coming from it being illegal not too long ago.
Yeah, it seems pretty crazy that, just excuse me, sorry. Just like even just 2 years ago, from when we started years and years ago, where you couldn't even talk about it, to being deemed an essential service is a huge flip. And I think that goes to talk about the nature of what cannabis has done for people. And again, I bring it back to the David Suzuki experiment. We may not have all of the double-blind randomized control trials showing the benefit of it in this very specific population, or maybe people just don't want to publish that data. I know people, by the way, in the US that have, and maybe I'll be able to get, some of them on here, that have tremendous amounts of data that they just don't want to publish right now because they can't still in certain parts of the US.
Oh, wow.
Because they're but we could talk specifically around sleep and huge trials that they've been doing for the last couple of years. Hold on. Go ahead. So sorry, I just see, fuck it, I already forgot what I was going to say. Go on.
Sleep is so important. Listen, sleep is so important. It's the one thing that crosses all disease areas. If you improve your sleep, you do. It's so amazing.
It for sure does. I mean, sleep is like, people come in with depression, and I'm like, well, why do you think you're depressed? You're not sleeping. It's not depression. It's your lack of sleep. Your depression will dissolve as soon as you sleep. It's like we're fucking, Energizer bunnies. You got to be recharged. If we don't recharge ourselves, it's not going to work. So tell me something aside from, what we were talking about, what brought you to CFAMM. What was it like growing up with psoriatic arthritis, and what were your symptoms of psoriatic arthritis?
I mean, I didn't get diagnosed with psoriatic arthritis, although I had it until into my 20s or 30s. They thought it was ankylosing spondylitis all along.
Really?
So, I mean, my knees blew up. It was the first thing to go in my teens. I was playing hockey. I was taping my knees with tensor bandages, probably from 12, 13, 14 on. I just felt they gave me more stability. And then, I mean, like you, dude, you can imagine what it was like living with this horrible disease when you're A-type personality, your career is set. I mean, I was in line to managing director, Citibank. I mean, that's a big role, and that's when you can kind of, watch and monitor and travel around, not just grind. But I mean, it was horrible. I mean, Susan Bartlett, if you know her, over in Montreal, she's a health psychologist. She's the one that showed me the data on young men with psoriatic arthritis and the suicide risk. And then we did a comorbidity survey with the Canadian Spondylitis Association under my leadership, and we saw the exact same thing with mental health, depression, anxiety. Factored in when you pivot the data and you see psoriatic arthritis compared to all the other ones. And then you also overlay that with the filter of psoriasis. And if you get both, your reporting of comorbidities on mental health and anxiety are through the roof. So it was horrible, man. And I had to lose my athletic career. I had to lose my career. But the blessing in all of this is I couldn't conceive. We dumped probably 20 grand into IVF back in the day. And now we've adopted our daughter, who's also my wife's second cousin and a product of the opioid crisis. So we're kind of doing full circle stuff around here. What
do you mean a product of the opioid crisis?
Yeah, 18-year-olds got together. Birth mother is adopted herself. Didn't get so lucky on the parents back in the day, ended up basically on the streets. 18 years old, became pregnant, couldn't support the child, thank God, stayed healthy throughout, It's also the birth father is my wife's cousin. And then basically we got the call. We were already in the adoption process. We had already done the international thing, and then we went to India and we kind of shelved it. We came back. That was when China was doing the Olympics, and a lot of people got stuck in the adoption thing there. So we kind of hung it up for a bit. We came back. We went local, and we adopted right out of Hamilton Children's Aid.
Wow, that's pretty huge. So that's huge.
And birth mom passed away last year on the opioid crisis.
Oh,
I'm so sorry about that. Yeah, the opioid crisis is taking a huge fucking toll. We can't forget. I think we're stuck in a pandemic right now of corona, of the SARS-CoV-2 outbreak, but I mean, we can't forget that there's still an opioid pandemic that's killing far more people.
Can I ask you a question on that?
Yeah, fire away.
Okay, so you see what's happening, and rightfully so right now with the crisis. I think it's been handled pretty well from a Canadian perspective and globally. I think it's needed that we have a common goal right now globally to get together and work on things, and we needed a step back. But why? I mean, the numbers are comparable. If Derek's got any type of slides on number of deaths and stuff, like why are we not putting this level of attention on the opioid crisis? It seems like it comes on the 6 o'clock news 2 days in a row, and then you don't hear about it again.
that's so true.
Sorry, what's that, Janelle?
I was agreeing with them. It's so true.
It's actually an amazing question you ask. And, I'm sitting here thinking about why on a daily basis aren't we thinking about the pandemic of opioids in the same way that we think of the pandemic of COVID. And I think one of the answers comes down to, because it doesn't affect us kind of picture.
Yeah.
It's not a transmittable disease that affects the affluent. I mean, it does. Opioids do, but it's an individual. It starts off as an individual issue, and those who aren't addicted to opioids have no fucking clue, and have nobody that's affected in their immediate life around it, maybe. And COVID affects. There doesn't care whether you have money or you don't have money, access to drugs, no access to drugs. It affects that population. So that population with influence has the ability to make shit happen. And that's really unfortunate. Fuck, when you think about it, I just started thinking about it now. I mean, it's kind of crazy when you think about it.
It's fucking horrible, right? I mean, I'm probably the only one on the line right now that has been up and down the opioid crisis. And by the way, right, when I gave up on healthcare, I didn't give up on healthcare. I gave up on the fact that I'm going to have to count on every single one of my doctor to know everything, right? So I had to become the quarterback. But like this opioid thing, man, is rotten, man. You just find one person that has it in their family, and that person, mother, father, whatever, they're paralyzed from this stuff. And I mean, we got to start paying attention to that. So, I mean, your bullshit detector, your show, we've got Expedition Wellness, and that's the objective really, is to get at an individual advocacy level to raise key issues that are barriers and try to tackle them through this platform instead of, the typical advocacy, which is also needed. But this is just another prong here that we can maybe make some movements on some key issues pretty fast. I mean, like CFAMM did last week with the help of C3 and George Smitherman and a bunch of groups that got together, Shecan and Ashley, all the collaboration that's happening kind of in the cannabis space on the advocacy groups right now. That's kind of our 2020 mission, is collaboration. We need to do this together. And I mean, we were able to slam down this essential service thing at a time where, it probably would have taken us, I mean, it's taken us more than 20 years right now to do that. So.
Right.
Yeah, I mean, fuck, thinking about it just really brings, it just brought a whole new dynamic to what we're going through right now. That why is it that we are not giving the same attention to why is the world not giving the same attention to the opioid pandemic that they have to COVID? COVID is affecting us right now, as is the opioid epidemic. one is, I don't know. I mean, one is infectious and can infect everybody, but I guess so can opioids.
It's,
So
this is why we're
wow.
bringing real life here, right?
Yeah.
We're in real life, unscripted, and we're going to get to these key issues. We're going to ask the questions because, I mean, what's happening right now with COVID is actually very remarkable, that how everyone's responding
Absolutely.
for the most part. And we need to put that same level of due diligence on this crisis, whether you're impacted or not.
Yes, I agree. And it's,
So,
yes, I totally agree with you. Do you think that it's, and I think one of the reasons it comes down to the impact. COVID can affect continues to affect everybody, but so did the opioid crisis. It's just didn't affect the privileged human, who who has the ability to go and buy PPE. There's some major issues that this just brought up, and specifically for me, it had me think.
And yeah, this is great. We're getting into it raw right now because, we've already committed that we're going to blow this up in a 3-part episode or something. I want to mention, at this point in time that I'll mention this because yourself and Philip Lucas from Tilray actually were very, very instrumental in actually me going on this opioid reduction thing starting at 4 years ago or so. At times where you would think, okay, maybe I got to give up here. I got another surgery that was a bit more painful. Then I'd pop in and I'd see a presentation from either you or Philippe talking about opioid substitution. And I'm like, bam, I can see that there and I'm doing it. So that was motivation for me. So I want to blow this thing up and get the appropriate people on the line so that we can maybe make some movement.
Well, now that we've raised this concern, I mean, it's something I'm definitely going to be advocating for because it hasn't gone away. We can't forget that the opioid crisis, it is a pandemic and it's still there. And I appreciate you telling me that because sometimes we walk out there and we're like, Tilray and Philip Lucas did the Topics trial there, Tilray's opioid prescribing practices or whatever the name of that study was. It was actually pretty good, showed a huge reduction in opioid use. And I did the cost study, the Cannabis for Opioid Substitution Therapy and survey, which we're trying to get published now, and showed like an 85% reduction in cannabis use. Or I should say 85% of the patients who filled out the survey had reduced their cannabis, had reduced their opioids. Jeez. So these are all things so I really appreciate it because we've been standing out there, trying to say this for a long time. And it's good to know that there are people out there that are listening. And I see the patient advocacy groups that are listening now. And you've just brought that to light. And that really makes me really happy about it. So, I mean, last thing, just before we move on, you have a podcast called Expedition Wellness that's thrown up on Cannabis.wiki as well. Fuck, Cannabis.wiki is everywhere. By the way, anybody, just to let everybody know what Cannabis.wiki is. Cannabis.wiki, before we get to Expedition Wellness, Cannabis.wiki is this outstanding digital platform that's quickly becoming North America's largest cannabis community, and they do anything from news to PR to having an app that's just about to explode, having a directory. If you're looking for a cannabis store that's open in your neighborhood or wherever you're traveling, you just come out, take a look, even from finding a strain that you're looking for. It'll tell you where it's at. And to original content, I don't think you're going to find another platform on the internet right now that's putting out as much original content as Cannabis.wiki is. So I think it's something we really have to commend Derek for throwing together and working so diligently and hard on, because it's fucking awesome. Awesome sites. Yeah. And one of the podcasts is and Janelle. Janelle is in there doing the PR. We'll talk to her in a sec when she starts talking about the news. But I want to just last thing is you have a podcast up there called Expedition Wellness. What's that all about?
Yeah, so I mean, we've been trying to figure out actually what it is, right? But the concept is really that I have a journey that I've kind of figured out a method. I'm severely impacted by disability, both physically and mentally, and I have risk factors. So I found out a way. Like I said, I checked out on healthcare. I've got great doctors, world leaders, and I trust what they do, but I also understand there's limitations.
Yeah.
So I went out and found my own stuff. I built a formula. I found the formula worked and built this over, 8 years or so, and still building it using my kinesiology background. And basically, we're going to share with consumers, and specifically, I'll be speaking to patients. We're going to try to get affordability issues worked on. We're going to try to find what I did. I built a system for me that works around nutrition, exercise, mind, body, pretty much everything that you can imagine. I'm a fan of a lot of tools for patients because we're all different and we all resonate to different things. But then what I did was I got it validated by a accelerated resistance training machine where you're doing your max all the time and the data comes up right in front of your face. So now I can say definitely that my system is actually working because I can see it on the screen. And then we're doing some brain IQ agility stuff because, as you know, with opioids, cognitive decline is something that you need to worry about. So I've got a journey that I've been on, and I've got a lot of great things to share. And I'm also cognizant that I'm very lucky in that I see a lot of people, and I mean, I'm not loaded, but I'm not financially strapped as many patients are. So I know I'm lucky, and I know what good service is. So we're going to try to create cost-effective ways to get to patients, and then we'll cover my advocacy work that I do, and that's the show. My co-host is Sandra Kudo. I think you know her pretty well. So she's my healthcare professional that can get on there and actually validate some of the things that I'm saying, like we're doing here.
I love it. Well, that sounds super interesting. Just on the last note, if somebody's suffering from psoriatic arthritis and they're interested in finding out more information on how cannabis can help, how can they get in touch with you?
I'm on social media. I'm pretty basic. I think it's Gerald with a G, J Major. And I mean, I'm pretty accessible on all these things. I can probably get creeped pretty well.
All right, cool. Because cannabis has definitely helped you and it's changed your life. I mean,
it's changed my life. I mean, I would say it continues to, I would say that it has saved my life and it continues to change my life. Right. And I can talk about it now because it's the new thing. So all of a sudden, all these people that are kind of burnouts and opioid addicts or whatever you want to classify me as, you can classify us all as the same, as we've consumed opioids for one reason or another. So I'm right there with a lot of people, and I've been discounted, I've been ignored, I've been, and rightfully so. I was problem with opioids and specifically around impairment is I know that there's been studies done that say, when you first get an opioid, you probably shouldn't be driving, but over time you build a tolerance to it. And I was shocked to hear that.
Crazy.
Because the difference with, and this is where, I don't care if you are using opioids, are addicted to opioids, you have a family or not, or you think you're not effective, man, you're going to get hit on the highway with a car with someone on opioids, because with opioids, you think you're God and nothing you do is wrong. So I would argue the impairment thing all day long on that stuff, but please don't think.
Actually, that's really important.
Yeah, and opioids do impact society because you did the cost analysis on this stuff. You see how many times people end up in hospitals. You know what's going on with fentanyl right now. Just take a walk in Vancouver.
Or downtown Hamilton.
Yeah. I mean, in Brantford and wherever. I mean, anywhere in your local community. So it's costing us money whether you want to like it or not. The problem is that people see mental health, addiction, and they see how it looks and it doesn't look nice, so they turn away. So that's fine. You can turn away and stuff like that, but have tolerance for it and get them into touch with people like yourself and start helping them.
That's well, I mean, your story is definitely inspirational to know where you came from and how it affected your entire life, and to find out that cannabis was able to bring back some of that life and help with all of those things is tremendous. And it just goes to show the nature of cannabis, the inclusivity of what cannabis can do for so many people, and how one medicine can affect so many different diseases, and that's the paradigm shift that's happening now. And instead of seeing 9 drugs to treat one disease, we have one drug that's treating 9 diseases, and seeing that happen, and you being an example of that, and maybe check out the Psoriatic Arthritis Society. That's probably a good one as well to look through.
So that's the Canadian Spondylitis Association. There's also the Canadian Psoriasis Network. And, go to CFAMM and fill out our petition. We've got about 1,000 signatures at this point, probably about 1,200 by now. So go check out CFAMM at cfamm.ca, CFAMM.ca.
Beautiful. Thank you so much.
Yeah, man.
Janelle.
Hey.
You're still staying on with us because we're going to do some news for the next 10 minutes before we close up.
I will medicate.
So, Janelle, what's happening? Anything happening in the COVID post cannabis phase 2? I don't know what the fuck to call this time of the world, but what's happening in the world?
Interestingly enough, I just saw an article where Canadian comedian Rick Mercer was he went on a little rant telling people not to share joints. And we're dealing with COVID right now, and it is something that you obviously can catch from somebody else. So he went on a rant about that, and the World Health Organization actually mentioned that if you smoke cannabis, you're actually more at risk because of the respiratory issues. So they're actually recommending that you use edibles during this time until we are kind of past COVID-19, which is really interesting because I didn't even know that until just now.
So I'm going to add, I'm going to change this a little bit. Combustion. When we talk about smoking, combustion is no good. Combustion could cause some lung issues. Vaporization of dried flower is totally fine. There is some increased risk of bronchitis with over ingestion, but for the most part, you should be okay if you're vaporizing just dried flower and you're not using it excessively. It is a bronchodilator, can help open up your lungs, but you do have to be careful with it, and that's where I do agree. Combustion is never good. So any form of combustion, and right now, combustion in general is probably not good because it puts you at a higher risk for severe infection with COVID. So you definitely should stay away from that. If you are somebody who vaporizes as a medicine, because the variability of ingesting cannabis is so great and some people can't tolerate it, I'd say it is okay to still vaporize, just not excessively. And of course, nothing over 195 degrees Celsius. Keep it low. And don't take long inhales, don't breath hold, do all the usual stuff in order to keep your lungs as safe as possible during this time. So that's a really good point.
Awesome.
So I should stop rolling this joint?
I see you rolling the joint there, making everyone else jealous.
Okay, well, listen, then let's listen. Okay, so I understand the caution, and I understand, and I don't want to be doing this either, but I have increased my oil consumption during this time. But I mean, I'm sorry, I grew up smoking joints, and I really just I need to get it going. So
Right.
So what would I do while still doing that? I mean, Manuka honey and stuff. Give me some things that I should.
I mean, we have to separate. I think the important thing to separate here is your recreational or lifestyle use of cannabis from your medicinal use of cannabis. I'm solely talking about I guess as a harm, I don't want to even use as a wellness promotion. I don't like using harm reduction. As a wellness promotion method, you shouldn't be combusting, period. That's just
Right.
a wellness promotion. If you're using it for a medicine and it's your only way to use it, then in moderation. Right? Moderation and common sense will go a long way during these times. And anything you can possibly do to decrease mucus and to improve your immunity is probably helpful at this time, and whatever it is, there are a lot of things that can help improve your immunity, anywhere from specific types of mushrooms that you're using or immune boosters, vitamin C, vitamin D, all those kinds of things, are Manuka honey, all those things, and specifically dark fruits and berries.
All right,
Those things,
I got it covered.
those things are all immune boosters. Will it keep you from getting COVID? Unlikely. Will it maybe improve your chances of having less severe disease if you do get it? Potentially. So you know, at the end of the day, just stay away from the things that potentially can cause harm at this time in particular. If you're using it as a medicine, like Janelle said, you know, probably best to stay away from it and use an oil if you can. If you can't, just use it in moderation. Sound like a good idea? That sounds super technical.
No, that's perfect. I mean, I'm all over the different types of mushrooms for immune boosting. I'm on the vitamin D, vitamin C. It's all good. Yeah, I think I'm doing enough good things. And like I said, I've probably gone down from about 12 joints a day to maybe 5 now. But I take more oils, and I started doing baths. CBD baths. So
yeah, good. What else you got in the news, Janelle? What do you got for me? What else you got?
We also, I've seen articles about the boom in cannabis purchases since COVID-19. So in particular, Canada saw a sales peak of 22% increase in sales from March 13th. So people are stockpiling cannabis, but one of the big things that we're seeing as well is that if in particular you order from the OCS, with Canada Post changing their protocols for delivery, your cannabis is no longer coming to your door.
Oh, it's not?
No, it's literally going from the warehouse straight to a Canada Post outlet. So you actually have to go pick it up. However, they have waived that 15-day window. So remember, like, you'd get the notice saying like you have 15 days to pick it up, otherwise we're sending it back to the sender. So now they're waiving that, and you have to go to the outlet to pick it up, because normally right now they would ring your doorbell. If you're not there, leave the postage notice. But the post is eliminating contact during deliveries. So they would typically just drop your package at your door, but they can't do that with cannabis because you need your ID.
Right, somebody has to sign for it.
So now it's going straight from the warehouse to a Canada Post outlet. So
that's important for people.
Yeah.
Although I think there's a few services that can bypass that. Excellent.
Okay. Well, that's good to know. It's something I certainly didn't know. I think it makes sense, though. You don't want somebody. I guess somebody has to sign for it, waiving the 15 days in case they're in isolation for 15 days, and then they can come out. I mean, I think that makes sense. Actually, that's huge. That's important to know. I didn't know. I did not know. And I think also that the sales are going up because there's all this panic and fear. I think something we have to remember is we're a lot fucking smarter than this. Molecule is, than COVID is. You know, it's a piece of RNA. It's like it's not even alive. It's literally, doesn't think. It doesn't act. Well, the way it works is basically it has a genetic code, and its genetic code is going to tell it what to do. And what I've been saying for the last couple of weeks is that us humans can think beyond our genetic code, and we can invent, and we can create, and we can, we're going to come up with cures, and we're going to come up with ways to beat it, because we can think above and beyond the way that it thinks. It doesn't think, it just acts. And things that just act and don't think, they usually lose. So we have to respect it, because it's dangerous and scary and all this other shit, but we're smarter than it is.
Yeah.
So we're going to definitely beat it. It's just going to be, we have to be smart, not dumbasses in the meantime, if that makes sense.
Absolutely. I think, like you're saying, you take your precautions, but you don't necessarily have to go into panic mode. And I think that's one of the things, like myself and my family, that we've kind of, we're taking the precautions, but we're not stockpiling, we're not hoarding it, because if the supply chain is still there, things are still going into stores, you just kind of have to take it day by day, because the panic doesn't help.
Let's just, sorry I keep talking, but just quickly on that, remember that, the stockpiling thing has trickle-down effect to patients, right?
Yeah.
We are not yet at a place where we've got inventory control and blah, blah, blah. So just to put that out there, we saw it with legalization.
Yeah. I've seen a lot of patients actually mention that online, that they're unable to get what they need because people are stockpiling. And that's really sad.
So stop the stockpiling. Anything else going on in the news?
Well, one other thing that I saw that was interesting is that while we're here talking about getting supplies, there are communities in Canada that are like completely isolated, right? So like, how are they getting the medical cannabis and the supplies out there? So it was interesting to see that there are some changes and people are actually using drones to supplies into these communities. And I thought, well, that's kind of, I mean, it's not that we're at this point, but it's really cool that we're using drones to deliver things like medical cannabis and other medical supplies to these communities that are so isolated, right?
That's crazy. They're like, here comes your drop of cannabis. Like, who would have thought this would have happened like even 2 years ago? That's insane. Wow. We're like up in, I have a friend who practices medicine. One of the docs who works at our clinic, she goes up north to like innovate for like a week every couple of months, totally isolated, small little places. And it's just tremendous to see what's going on out there. That's crazy. They're sending drones out there. I just, I worry about all people everywhere. Just be careful and stay safe.
Yeah.
All right.
There's there is another option as well for the rural, hard to reach areas, and hopefully it's going to get some traction through this this crisis. But it's actually being deployed right now out in Vancouver to assist with the opioid crisis. It's age-gated vending machines, dispensation. So that's age gating, which can apply to opioids, which can help with the fentanyl and the deaths, and cannabis is age gated, and alcohol is age gated. So this has many applicable. It's just everyone is focused on Build-A-Bear, and we can actually provide some better services and care.
So I mean, I think those are good points. We're going to have to think of all innovative ways to deal with distribution of all medicines at this point in time, and who knows when it's going to end. I mean, I just saw that article that Trudeau's saying, earliest is July. So I was hoping for June, but maybe July is when we get through it. Anyways, I wanted to thank you guys so much for being here. I think that's it for our show today. Just a couple things that I wanted to mention, things in summary. I think one of the things that we have to remember is that there's other diseases. There's the rest of the world hasn't stopped just because COVID is here. And we can't forget about things like the opioid crisis that are still happening. It's still a pandemic and multiple people are still dying from that. Stay safe, be inside. Social or physical distancing is really important now. Mental health, staying on top of your game is also important. Janelle, I'm super happy that you're part of the show now, and I love it. And Gerald, it was awesome having you on. Everybody stay safe. Don't forget to check out Cannabis.wiki. Don't forget to check out my socials. You can go on Instagram, Dr.Ira Price, and check out Synergy Health Services. Just the last thing to mention is we no longer we're doing everything virtually now. Our clinics are fully virtual. You no longer need a referral to see us. We're trying to decrease the barriers to access during this pandemic, and we're taking all the steps needed. So just give us a call. Go on the website, synergyhealthservices.ca. Make an appointment. Call us up. We'll get you in. All right, everybody. Have a wonderful day. Thanks so much for being around. And on behalf of everybody at the Higher Estate, have an awesome day. Peace.
All right. Thanks, bro.